This is CGTN, China Global Television Network.
Wuhan milestone, city where the first coronavirus cases were confirmed, reopens after 76 days under lockdown. British Prime Minister Boris Johnson spends a second night in intensive care. And the coronavirus pandemic raises food security fears in Zimbabwe. This is CGTN. Welcome to Africa Live with me, Beatrice Marshall, in Nairobi. Also coming up on the program. In business news, Kenya braces for a sharp economic downturn due to the coronavirus pandemic. And in sports, Tanzanian athletes hold on to Olympic dream despite the coronavirus pandemic. We begin with some good news. After being under lockdown for 76 days, the epicenter, Wuhan, has finally reopened transport links in and out of the city. Earlier today, Wuhan saw the removal of roadblocks from its highways. Traffic out of the city is expected to peak and then tail off over the coming week. Police say the number of vehicles transiting in Wuhan has reached about 50% of pre-lockdown levels. Travelers will be subject to strict checking of smartphone health codes and temperatures. Well, let's get some more on this exciting story, and we're joined by Shu Xiaqin, who is live for us in Wuhan. Thank you for joining us. Now, the lifting of the lockdown has finally allowed people to travel. Tell us what is happening now and what we can expect in the coming days.
Yes, on Wednesday, about 55,000 passengers are expected to leave Wuhan by train, while at the airport, about 130 flights are taking off, actually. It's the first time in over 2 months that people in the city can buy outbound travel tickets since the lockdown. A video went viral earlier today with the stewardess on the first flight of the morning welcoming passengers on board with sincere and strong emotions. And she broadcasted her thanks to Wuhan people for their strength, tenacity, and national solidarity over the past 76 days. Meanwhile, many stranded in Wuhan arrived in one of the city's 75 checkpoints, as mentioned earlier last night, waiting for the moment when police removed all roadblocks right after midnight. And taxi services also resumed today with the passengers showing their mobile health records. We also noticed that despite vigilance, many residents are willing to come out, as you can see behind me, as more and more cars are on the streets now. In hospitals, there are still about 400 patients, and 1/3 of them are in critical condition. But given that daily recovery is estimated about 70, many experts, some good news will be expected.
So it is definitely a momentous time there in Wuhan and for the rest of the world as well. And I can see traffic flowing behind you where you're standing. Tell us about the mood in Wuhan right now and how people are reacting to the reopening of the city.
Yes, indeed. We went to a popular pedestrian street in Wuhan on Tuesday. People there expressed relief about the end of the lockdown, and they took the day as a milestone for what the city had fought for despite lots of sacrifices, and they felt proud being part of it, not only about Wuhan's battle itself, but also the nation and beyond. Coming out for a walk with families and friends was not easy previously, and now it is the right season for many of them, who also try to caution the public to stay safe with masks on and other necessary measures. Last night, drivers ready to pass the toll gate told me that they felt distressed before, and now are very excited. They all feel grateful about medical personnel coming to aid the city during its most difficult times. And they said they wanted to do more in return. And I want to believe that Wuhan has so much to offer as well. Now, with more than 1 million cases around the globe, Wuhan's experience in the battle against COVID-19 is really an unforgettable one. So there is no textbook about the containment of the new virus in its primary stages. And without scientific knowledge about it, there may be no clear and effective strategy towards the pandemic. But more international cooperation is definitely the key to avoiding further disaster in our generation. Back to you.
So, Jiaxin joining us there from Wuhan, where the city has now reopened. Thank you. Now, since the outbreak began, China has mobilized medical workers from across the country to Hubei province. Just hours after Wuhan's lockdown on January the 23rd, the first group of 150 staff arrived in the city. On Chinese New Year's Eve, 450 medical workers from the People's Liberation Army were dispatched. Since then, over 4,000 military medical professionals have rushed to aid Wuhan. In total, more than 42,000 medical personnel were sent to Hubei. Of those, 19,000 treated the severely ill. Around 1,500 medics still remain in Wuhan. And a section of African leaders have been reacting to news of the reopening of Wuhan. Let's have a look at what the leaders think about the end of the lockdown.
Good news coming out of China with the end of the lockdown in Wuhan. It's very clear. It's 1 + 1 = 2 to resolve the coronavirus or COVID-19 problem. We can all learn from China what they have done in Wuhan. We are one global world. So thank you for giving us the lesson that the only way to contain coronavirus is to stay home and don't mix around, not going in the public trains or buses or public markets. That's the only way this disease will be contained.
That shows how successful measures taken by the Chinese government and the Communist Party in clamping down on the virus itself. And of course, it goes with the discipline of the people of China for adhering to measures put by the government. This is a lesson, of course, for the world. I think many parts of the country now who are learning on what the government of China have done in Wuhan.
Well, let's now go to Britain, where Prime Minister Boris Johnson remains in intensive care at a London hospital where he is being treated for COVID-19. CGTN's Andrew Wilson is standing by for us in London with the very latest on that story. Andrew, thank you for joining us on Africa Live. Let's start with an update on the Prime Minister's illness. What do we know so far about his condition?
Well, as far as the official medical reports go, he's spent his second night in intensive care. He is not on a ventilator. In fact, he is not undergoing any kind of treatment to assist his breathing. He is breathing by himself, but of course from time to time taking advantage of the oxygen supplies there in intensive care to help him along. We understand also a report this morning that his temperature may be down from yesterday. So all that would point to his condition being stable, which is the hospitals say that it is at the moment. But the fact that he's in intensive care, of course, remains to be bad news as far as his overall health is concerned, and also a complete worry for the country as they realise that without the Prime Minister, they've got to look to the rest of the cabinet to make up their minds about how we move forwards in this. Now, one of the concerns is that in reality, anyone who goes into intensive care, one can expect in normal circumstances 1 week of recovery for every day spent in intensive care. Well, Mr. Johnson now has been there for 2 nights. That would suggest that even if he were to come out of intensive care today, he might need a couple of weeks off work before he'd be ready to lead the country again. That is something that no one really seems that keen on discussing at the moment.
Well, that is the question, though, Andrew, because he might need a couple of weeks to be away from work. And there are concerns now about how the government will make key decisions in the Prime Minister's absence. Tell us more about this and how those concerns are being addressed.
Yeah, I think it's indicative of how we do our politics here in the UK, that the Prime Minister, whilst being ill at home at his flat in Downing Street and still persisting once he moved to St Thomas's Hospital in Westminster, continued to receive briefings, continued to receive papers to look through, continued to make decisions as a Prime Minister. Now, some people would say that would be against medical advice, that he should actually have rested. And some are even suggesting perhaps that his condition is worse because he didn't take the kind of rest one would expect to take when this ill for this many days. days. However, there is nothing in our constitution for replacement powers as far as a Prime Minister being incapacitated is concerned. Winston Churchill was sick and they kept it secret, and the Prime Minister in 1918 was sick as well, and they kept that secret because there is no official way of passing over the reins. Now, Dominic Raab, the Foreign Secretary, is the first Secretary of State. That means that he has the trust of Boris Johnson, that Boris Johnson trusts him to deputise on his behalf as far as cabinet meetings are concerned. But when Dominic Raab has been asked how much power do you actually have in replacement of the Prime Minister, he's not really able to answer that with any clarity. He says we make group decisions as a cabinet, but as everyone knows, even in normal times, let alone in a crisis, there are moments where the Prime Minister has to step in, squeeze the system, and actually force people to make decisions and impose his will on that decision making. It's not clear at this stage if Dominic Raab or any other member of the cabinet is endowed with those kind of powers, which means concern amongst the UK public that we may well be drifting at this stage.
Andrew Wilson joining us there from London. Thank you. Well, British Prime Minister Boris Johnson is in stable condition after he was hospitalised on Sunday and moved into intensive care. Downing Street said he was receiving standard oxygen treatment and breathing without assistance. Our correspondent Naweed Jabakil brings us the latest from London.
It's a disease that could attack anybody, including the UK's most powerful man. Prime Minister Boris Johnson has been forced to step back from leading the country after spending the night in intensive care. It's been almost 2 weeks since he first showed symptoms of COVID-19. Officials say he received oxygen support in hospital but hasn't needed a ventilator. With Johnson out of the picture, the UK's foreign minister is taking charge. And so far, he's been keen to show his loyalty.
It comes as a shock to all of us. He's not just the Prime Minister. For all of us in Cabinet, he's not just our boss. He's also a colleague and he's also our friend.
Messages of support have been flooding in for the British leader from across the political spectrum and out on the mostly deserted streets.
Well, obviously you want him as a person to be well and to recover. I think the main thing is government is a body of people, not a single man.
It is quite worrying for the country, for people in general, because what's going to happen? Because he's the leader, right, of the country. So I think, it is quite worrying.
It's unclear how long the Prime Minister's recovery will take, with Downing Street keeping details of his health closely under guard. As de facto leader, Dominic Raab appears to have the support of his colleagues. That's important because a lot of the key government decisions here are agreed by a cabinet of ministers. And Mr. Raab insists he'll be guided by the scientific advice. But there are real tough decisions on the horizon, especially around the national lockdown that's forcing people to stay indoors. There's no clarity on whether the man now in charge will be able to make those decisions in the same way the Prime Minister would have. And that could signal a power vacuum here at a time when Britain faces its toughest challenge since World War II. The UK is in its third week of lockdown and the coronavirus death toll continues to rise here. The country is fighting the battle with limited health resources and for now, without its most senior political figure. Naweed Jabakil, CGTN, London.
Back here in Africa, people living in the Democratic Republic of Congo's capital, Kinshasa, have taken issue with a 2-week lockdown imposed on a section of the city. The government shut down activities in Gombe municipality on Monday to limit the spread of the coronavirus. But that led to more people moving to other parts of the city where they pose higher transmission risks. Here's CGTN's Chris Ochamringa with that story.
Closed shops line the streets of Kinshasa's commercial hub. The government imposed a 2-week lockdown on the Gombe suburb to prevent the spread of COVID-19, and the police have been deployed to enforce it. But some Congolese have criticized the manner in which the lockdown has been implemented.
So many people who were based in Gombe have moved to other areas. We are worried that they'll end up infecting other people. I also saw officials selling badges meant for people providing essential services to whoever could afford to buy them. It's ridiculous.
The badges reserved to access Gombe were being sold to other people by corrupt officials. We don't know when our country will have order.
The governor of Kinshasa promised to punish whoever is found guilty of such wrongdoing. On Monday, he blamed the police chief for the poor handling of the lockdown. Activities in other parts of Kinshasa went on normally. Kinshasa is the epicenter of the coronavirus. It has an estimated population of 12 million people. Many of them who've been eking out a living in the central business district are happy the government did not impose a total lockdown in the city. But not many people are observing social distancing measures in other parts of the city. Chris Chamringa, CGTN, Kinshasa, Democratic Republic of Congo.
As COVID-19 spreads across the continent, those who live on the streets face a new threat. In Senegal, street children are facing a new challenge. Among those affected by the pandemic are talibés. Talibés are students from Quranic schools. Teachers send them out to beg as a way of teaching humility. The Senegalese government has banned the forced begging of children, but the practice continues nonetheless. The Human Rights Watch estimates there are around 100,000 talibés. An organization in Senegal, Village Pilote, is stepping up to help provide further assistance to street children. The organization has for 30 years been acting as a shelter for talibé. Now they have started handing out food daily. They also have been strong advocates for ending the practice of forced child begging.
I find it outrageous and inhumane that children have to be exposed as much as these ones. They didn't ask to be on the streets. I think the government, the people, and civil society, everyone today should focus on these children.
In Tunisia, many hospital workers, medical staff and patients have been finding it hard to access food during the COVID-19 pandemic. But a group of Tunisian chefs have volunteered to cook for them during these trying times. CGTN's Adnan Chauchi has that report.
The Tunisian Association of Culinary Professionals has invited its members to join the efforts. For several years now, Chef Wafiq Belaid has been cooking for the Tunisian national football team. Now he's preparing tasty meals along with other internationally renowned chefs for healthcare workers.
Solidarity is spreading in Tunisia as the pandemic continues. All Tunisian chefs from the most prestigious restaurants and ordinary people attempted to help us. This is the least we could do for our country.
And I'm working with all my colleagues to do 300 meals every day, lunch and lunch and dinner. We are delivering about appetizer, main course, and one dessert to all the doctors and all the medical teams.
The call for food donations started on social networks. As a result, hundreds of people and some enterprises have delivered free food products. The chefs have stockpiled the main ingredients for a healthy Tunisian cuisine.
I'm working with all my colleagues to make 300 meals every day, lunch and dinner. We're delivering appetizers, main courses and dessert to all the doctors and medical teams.
The general lockdown and the curfew have ruined many businesses. However, Elias, the owner of a prestigious restaurant in Tunis, has seized the opportunity and offered his help.
I have opened my restaurant and kitchens for unusual clients. This is how restaurant owners can contribute to the national effort to fight coronavirus. I'm in charge of logistics and hygiene in this operation.
During this time of unprecedented financial uncertainty for restaurants, more chefs across the North African country are stepping up to feed the healthcare workers on the front lines of the pandemic. The initiative of cooking for doctors, nurses and emergency medical workers battling the pandemic relies on donations. Some volunteers fear a shortage of funds. Tunisian chefs are now calling for more support and food donations until the end of the COVID-19 crisis. Adnan Shawishi, CGTN, Tunis.
The South African government, private companies and taxi operators have joined hands in improving hygiene and safety standards in public transport. The Gauteng regional government is now partnering with a number of companies to improve health and hygiene standards at taxi ranks across the province. CGTN's Julissa Jamela has more.
The taxi industry transports more than 16 million people daily. It represents a critical sector in the transportation industry here in South Africa. In Gauteng, South Africa's economic hub, The city of Ekurhuleni is on an aggressive drive to help ensure that the taxi industry is on board and are part of the solution.
We are doing our part in the fight against COVID-19. We are busy at work to support all the initiatives as announced by our Honorable President. We have, across all our departments, work that is actually taking place to actually ensure that we fight against, we intensify the fight against this virus.
SA Taxi has committed itself to supporting the taxi industry. SA Taxi has committed over 3 million rands in sanitizers, in masks that we have already delivered to the Gauteng Department of Roads and Transport. The bulk of the spending will be in Gauteng, and mainly because of the COVID disease finding its way as an epicenter in Gauteng.
The private sector companies that have partnered with the Gauteng government are offering a number of tools to help.
We are honored to continue serving the members of the community as well as the economy as assurance pointsmen. So we are going to be bringing passionate, committed, as well as staff that are going to be willing to disinfect taxis in all taxi ranks in the province.
We're seeing here all of us acceding to the call by the president when he said, we need to join hands, we need to collaborate, we need to work together to combat the spread of COVID-19. And we see Gauteng in action, hygiene in our taxi ranks, hygiene in our households, hygiene and even keeping distance amongst ourselves.
As part of endeavors to stop the spread of the coronavirus, taxis are now allowed to fill their vehicles up to 70% capacity. Gauteng government is continuously appealing to the taxi industry to ensure that taxi drivers comply with the 70% regulation, to also work hand in hand with government to stop the spread of the coronavirus. Yolisa Njamela for CGTN in Johannesburg, South Africa.
The first case of COVID-19 in Africa was reported on the 14th of February, and in just 53 days, more than 10,000 cases have been confirmed on the continent. Lesotho and Western Sahara are the only two African countries on the entire continent that have no COVID-19 cases reported. Let's now take a glimpse at how the virus has spread on the continent. And in the U.S., the rate of new infections is still on the rise. And Tuesday saw a grim record of almost 2,000 deaths in a single day. New York is said to be the epicenter of the coronavirus in America. But as CGTN's Nathan King reports, there are still some signs of hope.
As the darkest clouds descend on New York with a record 731 deaths in one day, there is a slim silver lining. The average number of recent hospitalizations for COVID-19 are leveling off, and the percentage of patients needing ventilators down slightly too. Could New York be reaching the peak of this crisis?
Right now we're projecting that we are reaching a plateau in the total number of hospitalizations, and you can see the growth and you see it starting to flatten. Again, this is a projection. It still depends on what we do. and what we do will affect those numbers.
The US President, meanwhile, setting his optimistic tone during a video conference with banks. They're providing cheap loans to small businesses that keep workers employed. There have been big problems with this federally funded program, and it will need more money. But the US President says the US economy will rebound like a rocket ship. At the daily coronavirus briefing, a more realistic tone.
We grieve alongside every family who has lost a precious loved one. New Yorkers are tough and strong and brave. New Jerseyites are tough and strong and brave, and they're being hit very hard right now. And for the next week, hopefully not much longer than that, it's going to start to go in the other direction.
The head of the Centers for Disease Control here in the US says he now thinks that the death toll in the US could be far lower than the up to 240,000 predicted just a week or so ago. But for that to happen, over 300 million Americans need to stay indoors for several more weeks. Nathan King, CGTN at the White House.
US President Donald Trump, in the meantime, has threatened to put a hold on American funding for the World Health Organization. Trump made the comments at a White House press briefing. He criticized the World Health Organization, saying, and I quote, "They missed the call," end quote, on the pandemic. But when challenged on whether it was the right time to make such comments, President Trump told reporters he was only looking at the prospect. And stay with us here on Africa Live as we still have more news for you on the program. Don't go away.
How will your world change today? What happens here? What happens there? Or what you make happen for yourself? If it matters to you, it matters to us too. Your stories are the stories that need to be told. Africa Live. Find your voice.
Economic data out of the country. The country's foreign currency reserves.
With a dedicated and diverse team of anchors, CGTN now brings Africa to the palm of your hand.
I'm Penina Karibe in the heart of Nairobi, which is bustling.
From everyday heroes to the continent's most powerful figures, we bring their voices to you.
We haven't changed.
And this is something most of us are very excited about.
We bring you news that's changing perspectives. News that brings Africa to the world. CGTN. See the difference.
And let's head to Ghana, where hundreds have lost their homes under a fire in a slum located in Accra's Old Fadama market. According to local media reports, 800 wooden structures were destroyed. It's not clear what started the blaze. Many of those living there were people working in the informal sector as mechanics or traders. They say they lost everything in the fire. The area was in partial lockdown to stop the spread of the coronavirus. The Ghanaian government also introduced physical distancing measures, curfews in some districts, as well as travel bans and partial lockdowns in the country.
I was lying down in this evening. I hear some noise, and I wake up and I see some fire burning. And right now I lost my everything. Even my room burned. So even I'm not taking anything in my room inside. Like as I now, if I get chance to go back to my place, I will go. Because right now I don't have anything at all there.
Because of the coronavirus, or how are they calling it, they stop us, we shouldn't do any work. So the money that we made it to save, that money that we are using to be feeding ourselves and our family. And this fire came out, burned everything. All of us have collapsed.
Meanwhile, Zimbabwe is among 18 nations that will be left worse off after the coronavirus pandemic, according to the United Nations World Food Programme. WFP says the drought-stricken country now needs donor aid more than ever before. CGTN's Farai Mwakutuya tells us more.
62-year-old Faisa Savanu lives off paltry earnings from collecting used plastic bottles and growing whatever she can in her garden. She's unwell and has back problems, which affects her ability to do both effectively. Because she's below 65 years of age, she does not qualify to receive food aid from the government. She literally has to scrape by to feed herself and 2 grandchildren.
We can't afford to eat in the morning, afternoon and evening. Most of the time, my grandchildren will eat before they go to school, and that's all until supper. They don't carry anything to school for lunch either.
Across the road lives Jenny Pararadza. She's among millions of beneficiaries of a social welfare food aid scheme, under which she used to receive 50 kilograms of maize each month, which has now been replaced by a cash payout.
The $180 I received can't meet my food requirements. The price of maize meal and all other commodities have gone up. Last month, I managed to buy just 1 bottle of cooking oil and a bar of soap.
That's left her and 5 grandchildren in an extremely difficult position.
During the last season, we harvested 1.5 buckets of maize, which won't go very far. We are already not eating properly, so this will just make life tougher.
The elderly neighbors live in Hopley, an informal settlement on the outskirts of Harare. Many of the residents here live in poverty. Already in dire straits, the economic fallout from the coronavirus pandemic will leave this community in an even more vulnerable state. The government has launched a $2.2 billion appeal to help it respond to COVID-19, a target that may be hard to reach given that as at February, the World Food Programme had still not raised the funds needed to feed 4.1 million food-insecure Zimbabweans. Farai Mwakutuya, CGTN, Harare, Zimbabwe.
As Rwanda marks the 26th anniversary of the 1994 genocide, grieving families will not be able to gather together as the country is under a lockdown. Television and radio stations are playing songs and programs to remember the victims. Here's CGTN's Daniel Arapmoy with the details.
Rwanda's 1994 genocide claimed about 800,000 lives. And every year, families of the bereaved gather around a memorial site to grieve their loved ones. But as Rwanda marks the 100 days of the genocide this year, the government has banned social gatherings and imposed a lockdown in an effort to curb the further spread of COVID-19.
The genocide survivors decided that they would follow 3 fundamental principles. The principles are to constantly work on remembering what happened, whether it's raining, snowy or sunny, or in the face of obstacles. These are the principles that are in the Rwandan constitution.
Qui est contenu même dans la constitution rwandaise. The coronavirus pandemic has spread throughout Eastern Africa, with the region confirming over 500 cases. Last month, Rwanda closed its borders as part of a broader lockdown designed to curb its spread. President Paul Kagame has said that Rwanda has to remember the genocide despite the coronavirus outbreak. He laid a wreath and lit the flame of hope at the Gisozi Memorial Site, where more than 250,000 of people were buried. Many Tutsis and Hutus were killed in the violence. To date, many of the victims are still traumatized about the merciless killings. Sur le plan psychologique.
On the psychological level, there are those who will relive traumatic experiences during this specific period. We have taken measures to try to contain this problem by working with medical experts. We, the Ibuka Foundation, have also contributed by training psychologists and mental health experts.
La structure médicale. With families under lockdown, radio stations and television channels in Rwanda are airing programs and songs that remember the genocide victims. Daniel Arap Moy, CGTN.
And your business news coming up next. Here's what's ahead. Kenya braces for a sharp economic downturn due to the coronavirus pandemic. And 3D printers in Brazil help boost supply of desperately needed medical supplies.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Africa Live. Find your voice.
Kenya's economic growth will slow to 3% or less this year from an earlier forecast of about 6% due to the effect of the novel coronavirus. The Finance Ministry had earlier given a 6.1% growth forecast for 2020. Meanwhile, the proposed income and corporate tax cuts aimed at shielding the economy will cost the Kenya Revenue Authority $12.2 million daily over the next 3 months. The Parliamentary Budget Office, the unit which advises lawmakers on financial, budgetary and economic matters, said revenue collection will drop by $1.1 billion. The drop is expected between April and June if lawmakers adopt the tax cuts. Parliament was to convene on Wednesday to debate the proposals, but the debate has been put off over coronavirus fears. Uganda's central bank has slashed its policy rate by 100 basis points to 8%. That's the lowest level in nearly a decade. The bank's Monetary Policy Committee says the COVID-19 pandemic and the policy responses to it has triggered a severe contraction in economic activity. CGTN's Michael Baleke filed this report from Kampala.
The Bank of Uganda says the economy is expected to slow down drastically in the second half of this year. The growth projections are between 3 and 4% compared to earlier estimates of 5 and 6%. According to the central bank, the coronavirus has heightened uncertainty, and its measures like social distancing have severely affected consumer demand. The manufacturing sector too has declined on account of disruptions to the inflow of raw materials, and easing the key benchmark lending rate is expected to lessen the COVID-19 pressure on the economy.
The central bank action yesterday to reduce the CBR was the necessary step that needed to be taken, especially at this stage as the economy really struggles to deal with this COVID-19. When you look at the global response, most central banks in the world have come up en masse to come up with measures to sort of cushion their economies. So Bank of Uganda is following suit.
The central bank has also directed commercial banks to restructure loan payments for their customers following the difficult business environment created by COVID-19. The monetary policy statement signed by the bank governor also notes that assistance will be given to commercial banks that are in distress for a period of up to 1 year.
The challenge most economies, including Uganda, that they are facing is how do you ensure that the financial system functions smoothly.
However, while there is significant uncertainty over the depth and the duration of the current slowdown, the Bank of Uganda is hopeful the economy will gradually recover in the second half of 2021. Michael Baleke, CGTN, Kampala, Uganda.
Nigeria plans to spend $1.39 billion to strengthen its healthcare infrastructure as part of its wider funding to tackle the coronavirus pandemic. Africa's biggest economy has so far confirmed over 200 COVID-19 cases and recorded 5 deaths. From Lagos, here's CGTN's Deji Badmus.
The government calls the initiative the COVID-19 Crisis Intervention Fund. Beyond strengthening Nigeria's healthcare infrastructure, it says part of the funds will also be used to support state governments in their own fight against the COVID-19 pandemic and create special jobs for about 774,000 persons across the country.
The establishment of this fund will evolve and provide the much needed cash resources from various special accounts already existing in the Federation, and this is a process that we will be doing together with the National Assembly.
With over 220 confirmed cases of COVID-19, there were fears that a massive outbreak of the disease in Nigeria would overwhelm the country's fragile health infrastructure. It's the reason why government is moving fast to ensure that doesn't happen. Already, 15 of the country's 26 states, including the federal capital Abuja, have recorded confirmed cases, and health infrastructure in most of the states are very poor.
Lagos State has already been provided with 10 billion naira in emergency funding. As the situation in the FCT and other states of the Federation evolve, the NCDC and the Federal Ministry of Health will make a determination and recommend funding support for any other state that has a critical need.
Lagos is the epicenter of the COVID-19 outbreak in Nigeria, but it also represents the country's best chance of winning the battle against the disease. The city has the highest number of confirmed cases in Nigeria, but it also has the highest recovery and discharge rate as well. And health authorities are upbeat the city would win the battle.
This was the original trend of last week, and the red line is the trend of this week, demonstrating that we've been able to flatten the slope of the curve. If we carry on with this strategy, we will indeed see a flattened curve and an improved capacity of the state and of its infrastructure to manage this outbreak without too many casualties or fatalities.
With funding support from the federal government, corporates and wealthy individuals, Lagos is rapidly ramping up on its facilities to deal with the disease. Isolation and treatment centers are springing up fast, just as testing capacity is also been scaled up. The city has recorded 2 deaths from COVID-19 so far. It's been effectively on lockdown for over 2 weeks now. If Lagos is able to wade through this period without much casualty, then Nigeria would be on the road to recovering from a virus which has crippled economic activities and social life in the country. Deji Badmus, CGTN, Lagos, Nigeria.
Oil prices bounced back Wednesday. Brent crude was up by 75 cents or 2.4%, while West Texas Intermediate rose a buck 30 at one point or 5.5%. Recovery was lifted by hopes that Thursday's video conference between OPEC and its allies will trigger output cuts to shore up prices. OPEC producers say they will agree to curb their output only if the United States and several others join in the move. However, the White House insisted that it would not intervene in the private markets as U.S. output is already falling without government action. Analysts say uncertainties remain over Washington's involvement in any production curbs. And to the United States, where the Trump administration on Tuesday asked for an additional $250 billion to support a program designed to help small businesses. The program, known as the Paycheck Protection Program, PPP, is part of the $2.2 trillion rescue package Congress passed last month. The program supplies forgivable loans to small businesses with 500 or fewer employees. Trump says that the government has already processed over $70 billion in guaranteed loans for 250,000 businesses since Friday. Larry Kudlow, a top economic advisor for the White House, says he believes the U.S. economy could reopen in the next 4 to 8 weeks and sees no reason why the second half of the year cannot resume a strong growth.
America's small businesses are the backbone of our communities. When you look and we hear all about the big companies that we know so well, but the small companies, when added together, are actually a bigger force. Our nation's 30 million small businesses employ nearly half of our workforce. My administration will continue to take the boldest action in history to bring immediate relief to the small businesses. So when we open up in a hopefully very short period of time, we're back into business.
Stay with us here on the program. We still have your sports news coming up. Here's what's ahead. Tanzanian athletes hold on to Olympic dream despite the coronavirus pandemic.
How would you create